Hello, this is Dr. Ryan Bell with Yada Yada. I'm going to talk about swaddling your newborn baby. It's been more of a common question that I've gotten in my practice over the last year or two. The American Academy of Pediatrics came out with some newer guidelines back in 2020 that discuss swaddling. So let's go over some of those important points. Generally, babies like to be swaddled. It kind of mimics that cozy, comfortable feeling that they have during their pregnancy, where they're snug and tight and warm and happy. We want babies to be that way once they're born. They tend to sleep longer, so swaddling tends to be a positive thing for parents and for babies, but it can be problematic. So let's talk about some of the guidelines. When you're swaddling your baby, you don't want to swaddle them too tight. We want to make sure that they're able to move around a little bit. If they want to bust out and move their arms, we want them to be able to do that. We don't want to swaddle too tightly on their hips, or there can be some issues positionally with hip development. So we want there to be some wiggle room there, but we don't want to swaddle to where they're loose enough to where those blankets will come open. Anything loose in your newborn's crib is not a good idea, because loose blankets or anything else can get up over their airway potentially. So you want them to be tight, but still able to move around a little bit inside of their swaddle. You're okay to swaddle a newborn until they get to the point that they're gonna start rolling over. So if a baby's swaddled tight, they're positioned on their back to sleep, which they should always be. If they're starting to roll over on their own, there's concerns that the face goes into the mattress. There can be other factors there that block the airway. And obviously that's going to be an increased risk for suffocation or for a sudden infant death syndrome type of a problem. So once your baby's able to start flipping over and getting onto their stomach, then at that point is usually the recommended time to stop swaddling your baby. We encourage putting babies in sleepers or wearable blankets that aren't going to come loose. But again, you want to be careful not to overheat your baby. If they have too many layers, if they're too warm, babies tend to feel warm to the touch. They can get sweaty or damp hair. They can breathe quickly, or they can just not sleep well and not settle well. And so you're always kind of watching temperatures. A good general rule is that your baby's going to need one extra layer from what you need to stay comfortable at any given temperature in your house. Like I mentioned, we always encourage putting babies to bed on their backs. So even when they're swaddled, we want to put them on their backs. Talk to your pediatrician if you have specific questions or concerns about swaddling or about your baby's sleep. But generally those guidelines will keep your baby happy, sleeping good, and safe. Thanks.